Welcome, folks who are joining us. We're going to get started in just a few minutes. All right, welcome everybody. Before we get started, I'm going to invite our interpreters to help you navigate the live interpretation that is available in this webinar.
Thank you. Hi, everyone. We are offering interpretation into Spanish today, so I'm going to make an announcement for Spanish speakers, and then we'll switch back into English. Bienvenidos. Tenemos interpretación al español hoy. Para acceder a la interpretación, tienen que seleccionar su canal yendo a la barra de abajo. Van a ver un globo terráqueo. Tienen que hacer clic en el globo terráqueo y seleccionar español. Y si están en un celular o en una tablet, tienen que hacer clic donde dice más o tres puntitos. Y lo mismo si no ven el globo terráqueo, ir a donde dice más, hacer clic en el idioma, y si están en un celular tienen que hacer clic en finalizar. Entonces con eso, por favor, seleccionen su canal y ya comienza la interpretación, así que ahora voy a pasar a hablar en inglés. Okay, so interpretation is happening into Spanish. Um, just a brief announcement for the speakers. We have already covered this before the webinar started, but we ask that everyone please speak at a slow pace so that we can ensure to translate in everything that is spoken today. Please make sure to speak clearly into the mic and to mute your mic when you're not speaking. Please avoid acronyms, which we love to use in these spaces. And if you're using an acronym that is very commonly used in these convos, at least the first couple times you use it, spell out what the words are so that we can establish the translation of them. And yeah, just avoid jargon, spell out words. It helps everyone. It makes it more accessible. And if you are speaking a little too fast, you might see us turn our camera on and go like this. And if you see the interpreter desperately going like this, but the speaker isn't seeing one of us, then or if we're putting SD or slow down in the chat and the speaker isn't seeing us, please just turn on your mic and let them know that we're requesting they speak more slowly. Lastly, please read out the questions or any chat messages out loud before responding to them. That way we can make sure that they're translated before you respond. I think that goes for the Q&A more than anything. And yeah, we will translate whatever questions are put in the Q&A in Spanish. We want Spanish speakers to know that they can put in their questions in Spanish and we'll make sure that they're translated. Yeah, I think that's it. Thank you.
Thank you so much to our interpreters for helping to make our spaces as accessible as possible. We can go to the next slide. Thank you. So I just wanted to welcome everybody to Care Not Control, Support Youth Autonomy. And this is a live panel discussion about young people and their access to abortion, gender affirming care, and other reproductive health care. name is Amanda, and I'm the Movement Building Director at the National Network of Abortion Funds, or NNAF. And I will be your moderator this evening. And before we really dig in, I wanted to share with you all some notes about accessibility and community agreements around language. So we have on our slides here, we have live captioning in English. Captions will appear at the bottom right of your screen, and you can turn them on and off by clicking the live transcription button on the features bar on Zoom. Um, In terms of security and privacy, this event is password protected, and so you all should have received an individual link for you to access this call. This is how we keep our calls as safe and generative as possible. And then if we could go to the next slide and the next one. We will have the Q&A feature enabled during this webinar, and that is for you to be able to share questions at any time. So you should be able to see along the bottom bar of your Zoom the Q&A button, and you can click on that, and that will open up the panel, the Q&A panel that will let you ask a question. Folks here on the support team will be selecting questions for our panelists to answer when we come to our Q&A section. And then I wanted to just make a note about some community agreements that we have around language. So at NNAF and at most abortion funds as well, we use gender inclusive language to refer to people seeking abortions and pregnant people. So, for example, instead of saying a woman trying to get an abortion or a pregnant woman, we say a person trying to get an abortion, or a caller, or pregnant people. For many of us, this is not theoretical. So we thank you for your care and attention to this. And on the next slide, if you want to read more information about this, we have a resource linked from actually one of our guest organizations here. We Testify has an explainer around abortion and queer and trans justice. So we encourage you to check that out. And so as facilitators and panelists, we're going to model this. And if we make a mistake, we're going to correct ourselves. And also, if we hear others on the call using gendered language, we will gently and lovingly remind you to use gender inclusive language. Thanks for listening to that accessibility piece, and glad we're on the same page now about language. Now we're going to talk a little bit about why we're here today. So over the last year and a half, we've seen a tremendous amount of legislation targeting abortion and gender affirming care for young people. And that's all been driven by the current administration. Even so, adults are facing legal consequences for helping the young people in their lives access the care they need. And so culture and politics are working against young people in accessing the care and the dignity and the autonomy they deserve. And so today we're here to center those stories of young people and to learn from our experts about the barriers that young people face in accessing abortions and other reproductive health care. What are they doing to support each other and how you can help? So in this panel, we will hear from folks who are or work with young people as they navigate accessing abortions and other healthcare under our hostile government, stigmatizing culture, and increasing surveillance and criminalization. And so the way we're going to do this is we're going to have our panelists share a little bit with us about their work. They have some short presentations. And then we will open up the space for questions using the Q&A function in your Zoom window, as I just explained before. So that's going to be our process. And at the end, we're going to drop some resources for you all and send you in the direction of the wonderful organizations we have on our call with us today. So we can go to the next slide. And I want to just introduce our panelists real quickly. They're going to go a little bit more in depth in their own introductions, but just first want to have appreciation for Nastasia from We Testify, Morgan from the Abortion Fund of Ohio, and Zoe from Advocates for Youth. They are going to be our panelists, our experts, and I'm going to turn it over to Nastasia first, who's going to get us started.
Hi, thank you so much for everyone for being here, and thank you so much for the introduction, Amanda. Um, sorry, could do next slide, please. And then this is just kind of the front page of my presentation. So the youth access panel and my part of the presentation. Thank you. And again, thank you for the introduction. Hi again, everyone. My name is Estasia Juarez and I use she, her pronouns. Thank you. And thank you all so much for being here today. I'm joining you all from Cicero, Illinois, a western suburb of Chicago. I am so honored to be here representing both my own experience as a young person who had to navigate abortion care twice and the work I now do full time with We Testify as the operations and programs coordinator. I want to share how my abortion experiences shaped me, how storytelling became a form of leadership and healing in my life, and why young people deserve abortion access without shame, stigma, and impossible obstacles. And most importantly, I'm deeply committed to showing up for people who have abortions and making sure no one feels alone while navigating their abortion care. Next slide, please. And then welcome again. And I'm going to go briefly into about who is We Testify and a little bit about our org. So at We Testify, we use the power of real stories to change how people see abortion. Through the stories we tell, we build more than just awareness. We build community, leadership, and power, and we support our abortion storytellers every step of the way. And that looks like preparing them to share their stories, caring for them through the process, fostering community, and compensating them for their time and emotional labor. We focus on centering diverse voices, especially from people often left out of the conversation. And when we share abortion stories, people begin to understand the full human experience of abortion, break down stigma, and create a more compassionate culture. Next slide, please. So, to understand my passion for youth abortion access and abortion storytelling, I want to share my own experience navigating abortion care as a young person. So, I'm going to go a bit over what navigating abortion care as a young person looked like, how was seeking abortion. Sorry, I'm going to go slower. Seeking support in high school and college, feeling isolated and breaking stigma and communal care. So, a little bit of background. I come from a low-income household in a community where abortion was never talked about. When I became pregnant at 17, I felt completely lost and isolated. I was in high school thinking about graduation in college, and everything felt overwhelming. But even in that confusion, I knew one thing clearly: I did not want to be pregnant. Abortion was my immediate decision, but I had no idea where to turn. I didn't have social media at that time. I didn't know about abortion funds, all the repro orgs that are out there, so I turned to the internet as my only source of information. And that led to some of the misinformation young people come across when seeking abortion care. And when looking up abortion care near Chicago, I ended up at a faith clinic, what we know as a crisis pregnancy center. I thought I was doing the right thing, going somewhere that was supportive, quote unquote supportive, because of the free pregnancy testing and counseling that was offered. Instead, I was shown an ultrasound and a heartbeat and pulled into an emotional narrative meant to make me question my decision, even after I had said I wanted an abortion. This stayed with me because it's easy for young people to have this misinformation presented when it's the only thing available to them. Eventually, my mom helped me access care through Medicaid, my insurance at the time, and I got my abortion pills at Cook County Hospital. I felt alone, and that was due to society teaching us that people who have abortions should feel ashamed, and I internalized that stigma. I isolated myself. I went through my abortion completely alone. I stayed at my aunt's house while she was gone, so no one would be around me. I didn't want to talk to anyone. I carried that shame that society places on people who have abortions. Even though I knew I made the right decision, I felt like I had done something horrible. And a year later, almost the exact same week, I found myself pregnant again. This time, I went to a family planning clinic in Chicago that also accepted Medicaid. The difference was immediate. I was informed, I was offered pain medication, I was walked through the process with care. I knew what was happening and I felt supported there. And yet, the stigma was heavier. This time, it wasn't just abortion stigma, it was stigma around having multiple abortions. I started believing I had lost value, that I didn't deserve good things, and the internalized shame and stigma was so real that I told myself this was something I would never speak about, but that silence didn't last. What changed everything was an internship application with collective power for reproductive justice that I applied for in my junior year of college. And one of the questions that was asked was, what does reproductive justice mean to me and how it impacted my life? For the first time, I wrote about my abortions. I wrote about stigma, shame, access, and isolation. And that application led me to We Testify, and that changed my life. For the first time, I didn't feel regret. I felt relief. I found a community where my story wasn't something to hide, it was something that mattered. I realized that sharing my story could help someone else feel less alone, more seen, more supported, and that realization radicalized me. Through storytelling, I learned that I have value, my story has value. I made the right decision for myself both times. I wasn't ready to be a parent, and I didn't have to be. Abortion saved my life. I also recognized that I had access, and not everyone does. That's why I continue to tell my story, to shine a light on barriers, reduce stigma, and again, remind people they are not alone. And thank you all for listening to my story and giving me the space to share my story. And that leads me to my next slide, please. Young, yes, young people fighting back. So, young people are truly at the front lines, building peer-to-peer support networks, creating abortion access guides, sharing resources online, social media, and helping people find abortion funds, and making sure their friends don't have to navigate care alone. Through my work with You Testify, where I support some of the programming, that is a partnership that we have with We Testify and Advocates for Youth, Abortion on Campus. The Turning Away study that I've been a part of was sharing resources on college campuses, where at the time I was at the University of Iowa. I've seen firsthand how storytelling and community support transforms people's lives. And with We Testify, I also lead Abortion Storytelling 101, where people learn about abortion stigma, reproductive justice, and how to safely share their stories in the ways that they feel most comfortable with. And next slide, please. I'll get a little bit more into community and peer-to-peer networks. So, as I said, for me, storytelling is one of the most radical tools we have for change. When people share honest abortion stories, we break down shame and stigma and replace it with connection and power. Storytelling reminds people who have abortions that they are not alone, and it creates space for others to speak up too. One of the most meaningful parts of being part of We Testify has been finding community with other storytellers. And the photo here that you can see is from the storyteller retreat that we had in 2024. And just to note, we also do hold storyteller retreats annually where we all come together to share our abortion stories. It's filled with joy, being in community, and just being able to be with each other. I was also a part of this cohort in 2024 as an intern with We Testify. And like I said, that community changed my life. It is truly something special that We Testify holds, and also because of abortion storytelling and these retreats, this creates visibility as safety, showing other young people that they are not alone in their experiences, because not every abortion story is tragic, and not every abortion story is full of regret. Some are about relief and choosing yourself, and these stories deserve to exist and be heard. And as I mentioned in the beginning slides, storytelling became my leadership practice. And I want to say that storytelling is a practice you choose what to share, how much to share, and who you're sharing it with. And your story doesn't have to include every detail to be powerful. Each time I share my story, it looks a little different, but the purpose stays the same. I want to expand the narrative of what abortion stories can look like. Next slide, please. Thank you. And as I close out my portion of the presentation and we hear from the other incredible panelists, I want to leave you all with a question to sit with today or throughout the rest of the week and the weekend is, what is one way you can stand beside young people in their fight for abortion access? Thank you all again so much for listening and being here today. Thank you.
Thank you so much, Nastasia, for sharing with us about your work and your abortion story and just how much that is leadership. I really appreciated that framing. I'm going to now pass it to our next panelist, who is Morgan from the Abortion Fund of Ohio. I think we can go to the next slide.
Hi, my name is Morgan Mitchell, she, her pronouns. I'm the legal program manager for the Abortion Fund of Ohio. So that means that I work with teens who are navigating the judicial bypass process. And I also work with people who have been criminalized for their pregnancy outcomes in Ohio. Next slide. So after Dobbs, more than half of American adolescents, so 13 to 19 years old, now live in states with severely restricted or no legal abortion access. After the 6-week ban in Texas, adolescents had the largest decrease in abortion rates, and we see this in other states now that have had abortion bans as well. Even where abortion is available, securing appointments has become more difficult. In Ohio, if a minor is getting a judicial bypass, they have to have 2 appointments, one for the consultation, then they get their bypass, then they go and get their abortion. So it's a lot more difficult. They're more likely to delay expenses or need to sell something to pay for care. Minors have higher rates of accessing self-managed abortions than older adults. And there are now so-called abortion trafficking laws that target minors leaving the state for abortion care. We see that in Indiana and in Idaho, where if a minor is trying to leave the state to obtain an abortion, the adult that is helping them could be charged with trafficking. And there is a huge research gap around minors and abortion access. So getting information like on this slide is incredibly difficult because minors are left out of research when it comes to abortion access. Next slide. So these are the barriers to care that I see when working with minors getting their judicial bypass. The surveillance that they are under in schools is extreme. If they miss class or extracurriculars, it's their parents are alerted to that. Um, so a lot of times they can't miss school to obtain an abortion, but a lot of abortion clinics are not open on weekends. So it's the only way to obtain an abortion is to miss class, and so that creates a massive barrier. Transportation, a lot of the minors I work with don't have cars or don't have a license. So getting to their appointments and getting to their judicial bypass hearing it can be really difficult for that. They have difficulty leaving their home or residence. So a judicial bypass is where a minor is getting permission from a judge to obtain an abortion without their parent knowing. And that's very difficult to do when parents constantly are surveilling their children and surveilling teenagers. So they have difficulty leaving their home or residence without their parents knowing. And then, of course, abortions are expensive. So appointment and related costs, a lot of teens either don't have jobs or work in minimum wage or internships that don't pay. So getting appointments, getting funding for their appointments and the related costs to getting to their appointment is very difficult for them to obtain. And then, of course, there's navigating the legal system for getting a judicial bypass. In Ohio, it is very confusing. Most courthouses, when you call, don't know what you're talking about, or they claim that they don't do that. And so, actually getting to the courthouse, getting answers to your questions, and seeing a judge is incredibly difficult. Like I stated before, they have a waiting period and a two-appointment minimum. They have to get their consultation, then they go to the judge and talk about their consultation, and then they go and get their abortion. And like Nastasia was talking about, there is a lot of stigma and shame around getting an abortion as a teenager. And so that can also be a barrier to accessing an abortion because they don't want to navigate that stigma and shame. Next slide. So I've said this a lot, but a judicial bypass is a legal process for a minor to access abortion without their parent or guardian's permission. This right judicial bypass is established in a federal court called Bellotti versus Baird. But now that Roe and Casey are gone, we're not sure how long we can rely on this federal basis for a minor's right to abortion. In Ohio, we have legislators who are fighting against our reproductive freedom amendment in our state constitution, and they are saying it is because they uh, it has given minors more access to abortion and gotten rid of the judicial bypass requirement. However, that is not true. There is still a judicial bypass requirement. And so we see minors being used as pawns or as arguments for why there shouldn't be abortion access in different states. This is a huge method of surveillance and um, control over youth autonomy and over their bodies. You shouldn't have to go in front of a judge and go to court as a teenager and defend your right to have bodily autonomy. But we see this in 36 states, so it is quite common. Next slide. And then there is criminalization. A lot of teachers and coaches can be either helpful or they can notify guardians if they're concerned about legality. We had a teacher tell a counselor about a student being pregnant, and then the teacher and the counselor then told the student's parents, which put the teenager in great danger because her parents were not um, pro-abortion. So that was a really scary case we had. We have social workers that rely on systems and processes that hurt their clients, so like mandatory reporting. And that can lead to unnecessary reporting because there's a lot of times they don't understand the limits of mandatory reporting and what you don't have to report and what you do have to report. We've had healthcare providers break HIPAA to report suspected minors' abortions to law enforcement. One of our criminalization cases was a minor. Um, she had stillborn twins and then experienced postpartum eclampsia and went to the hospital. And the hospital told law enforcement they think that she forced uh, the birth. It was an abortion, forced abortion. And law enforcement wanted to um, arrest her in the hospital, and the doctors actually stopped them and said, "This is our patient, and you're going to have to wait until we're done treating her." And so that healthcare provider put that minor in great danger. And then there are other medical experts hired by prosecutors that may rely on junk science or faulty forensics to harm minors. We have seen um, something called the lung float test, where if the fetus's lung floats in water, it means it quote unquote means they took a breath outside of the womb. This is not accurate science. It actually goes back to witch trials, and if women floated, they were witches. Um, so it's goes back to other junk science in the past, and it's still being used today and by prosecutors. And so to try to claim that to try to pass murder charges when in cases of stillborn um, fetuses. So there's a lot of criminalization that happens around minors in these different areas that we see. And the case we worked on with the healthcare provider breaking HIPAA to contact law enforcement, we were able to get the charges down to tampering with remains, and it was removed from her record when she turned 18. So it was a positive outcome. I guess the most positive you can get in that kind of situation because she had turned 18 like months after we got the decision. So, but a lot of minors aren't that lucky, and criminalization is a massive barrier to obtaining an abortion and honestly just having birth justice as well and having being able to go to hospitals when you're experiencing things around birth. So that's something that we are working on with pregnancy justice, and making sure that minors don't have these actors influencing and criminalization. And that's all I have for y'all.
Thank you so much, Morgan. That was really, really illuminating, and it already has me thinking about some questions I want to ask. So, I appreciate you for setting us up like that. We're going to pass it to our next panelist, our final panelist, Zoe. And I will go ahead and hand it to you, and I think we can go to the next slide.
Hi, good afternoon and evening based on where you're joining. My name is Zoe Miller, and I am with the Youth Abortion Support Collective with Advocates for Youth. And I'll be talking more about abortion access organizing and what young people are doing and the surveillance we see through that end. So we can go to the next slide. So I am based in Omaha, Nebraska, currently joining you from sunny San Diego, California right now. Like I said, am a member of the Youth Abortion Support Collective. Previously in 2025, I was a co-lead for the Youth Abortion Support Collective for the Midwest region. And in the 2023-2024 school year, I was a member of Abortion on Campus through Advocates for Youth during my undergrad. I have my bachelor's degree in public health from the University of Nebraska, Omaha. In my day job, I get to do policy work on behalf of the Nebraska Coalition to End Sexual and Domestic Violence, working with survivors and crisis centers across the state. And then in my free time, I get to be a clinic escort with Nebraska's abortion fund, NEAR. And we can go to the next slide. So, a little bit about both the programs I just mentioned. The Youth Abortion Support Collective, sometimes known as Youth Ask, is a nationwide network committed to becoming expert resources on abortion and ensuring folks in our communities know their options. There are about 1,000 members across the whole nation in Youth Ask, spanning across different regions. As members, they have access to group chats, both for everyone and then within your regions, or people who do campus organizing or high school organizing. You get resources to online catalogs, abortion doula courses, regional events, and so much more. It's also a great opportunity for those who like to network with other young people. The Youth Ask co-leads, something I was a part of in 2025. We get to identify and address gaps in local abortion access support and mobilize young people within our regions. There are about 12 or 13 regions that we're split up into. And then with Abortion on Campus, it was formerly known as Abortion Out Loud and the 1 in 3 campaign. But Abortion on Campus harnesses the power of storytelling, grassroots organizing, leadership development, and policy advocacy to end abortion stigma and strengthen support for young people's access to abortion. Activists leading the Abortion on Campus project in their community host speakouts, do public education campaigns, and work with campuses and local officials to strengthen young people's access to abortion services. And we can go to the next slide. So some of the projects and successes we have seen from both Youth Ask and Abortion on Campus are the following. Abortion support trainings happen year-round. These can range from abortion doula or abortion support person trainings that last 7 weeks. Youth Ask co-leads get to attend in-person trainings. Abortion Out Loud or Abortion on Campus also gets to meet for 2 days and really establish plans, action plans, curriculum, and really be able to understand what other folks across the country are doing, whether that's successes they've had or even failures they have had, and how we can grow from it. Another successful project we have seen is around medication abortion campaigns in different states, most notably in Massachusetts and New York, where young people were able to get bills passed through their state governments or work with their campuses to get medication abortion more accessible, which is super cool to see that is starting to pick up a little bit more. One of the biggest projects that Youth Ask members and Abortion on Campus members really like to rally behind are emergency contraception vending machines or emergency contraception peer-to-peer networks. Right now, there are over 350 campuses that have some sort of program that is either emergency contraception vending machines or peer-to-peer networks. Additionally, building up relationships with their local abortion funds or doula collectives, making sure relationships are built there between young people and the staff or volunteers of those groups. And then something that I've seen more throughout Youth Ask is organizing rideshare and abortion aftercare kits with local funds, clinics, sometimes we'll see Planned Parenthood in there, or other groups on campus. And we can go to the next slide. And then some of the work I did on campus during my undergraduate degree was establishing a emergency contraception peer-to-peer distribution. And really, it became out of a lack of institutional support through my college campus. When we think of surveillance, sometimes we do think of doctors, social workers, maybe family, but I think a lot of times we need to look at the university system and how they are connected to our government, particularly state government, or different connections they may have to powerful institutions. We saw lots of pushback for having emergency contraception on campus, and for me and my organizing journey, it was really one of those things where I would ask for forgiveness later, because it was something that was such a need on campus. When we didn't have a pharmacy, a vending machine was not in the cards either. Additionally, I was able to work with a local nonprofit to help establish emergency contraception vending machines in our community. So I was responsible for getting our first one in Nebraska, and now, as of now, we have over 5 EC vending machines throughout our whole state. Also, building relationships with our local abortion fund near Access Period, which is a statewide period poverty nonprofit, and our campus pantry due to that administrative campus surveillance. Something we would see quite a bit at the university I was at was um, being told students and staff can't interact on these issues when it comes to reproductive health, reproductive rights, reproductive justice, abortion access, gender affirming care, doing advocacy around it. Um, so, building these relationships outside of the university and just having people to talk to is incredibly important and something that I think we can always do a better job of. We also did work around legislative advocacy when we had abortion and gender affirming care bans introduced at the uh, state level, when we were banned from doing so explicitly. Really just making sure that we're advocating for the students and our community in Nebraska. And sometimes doing the right thing is not the right thing for administration. Additionally, helped with pro abortion chalking and stickering, and just really getting the word out about what options were in Nebraska. We are a more restrictive state, so making sure that people know we do have an abortion fund, we do have clinics that provide medication abortion. Plan C pills, having those stickers around campus were always something that caught people's attention. Um, and then also doing signature gathering for Nebraska's abortion ballot initiative in 2024. Although it did not pass during the 2024 election, still being able to gather a record breaking number of signatures in our state was very cool to see, and it really is thanks to the young people who were able to do that on campus. It can be so, it takes a lot of bravery to do that. And kind of wrapping up here, I think the most important thing when we're trying to support young people is making sure you're being attentive and listening and seeing what their needs are, and honestly being able to reach out to them. We know that surveillance runs so deep, and especially young folks who are organizing on high school and college campuses, they often will be limited, or it may feel like they're limited in what they can actually do. So, being able to lend a helping hand, being able to have someone to talk to, provide funds to them, goes a really long way in making sure we can make amazing projects happen that will support abortion access throughout our entire nation. Thank you all so much.
Thank you, Zoe. Thank you, everyone, for really grounding us today in what the experience is for young people who are trying to access care in environments in states that are super like restrictive and hostile and truly making so many things harder for young people trying to access abortion care and gender affirming care and other reproductive health care. I know Morgan was naming birth too as a site of of criminalization and of surveillance for young people. And so I want to open it up to questions. I don't see any in the Q&A so far, but folks, you do have access to a Q&A function. It is down at the bottom of your Zoom window and the little cast bar. You may have to click the little circle with three dots that says more, but you should have access to that. And while we are waiting for maybe some more questions to come in, oh, we can end the slides now. Want to switch some things around so we can see everybody. And I have a question to start us off. Uh, it really is based on what a lot of you all shared. So, what I'm gaining from your presentations is that it seems like young people are functionally constantly the most surveilled people by schools, by parents, faith leaders, courts, doctors, and other healthcare providers, and social service providers. Like you all, to one extent, named all of those actors as people who are part of that perpetuation um, of stigma and of criminalization. And so I wanted to actually ask about a specific impact, and I wanted to ask you about how does abortion and gender affirming care criminalization impact young people's access to supportive community? Thinking about like adults that might actually be supportive, or like different people who folks trust. So, wondering what folks think about that. Like, what is the impact on young people's ability to build a community that they trust? Anyone can start.
Thank you for that question, Amanda. I can get us kind of started on that conversation. So, as a young person, someone who had to seek abortion care, all those things, all that those things came up, like surveillance, criminalization, about who I told, what I searched online, because as I shared in my story, like the internet was like just looking on Google, I was like, where can I get abortion care in Chicago? And that things like that are scary. Like just even if the care is available, that fear and shame is still there. And the culture of surveillance impacts that trust. And young people avoid doctors, counselors, because they don't know if their privacy will be respected. And at that time when search like seeking abortion care, young people are already navigating so much of that fear and stigma, and they become scared to ask those questions and to seek those resources and to have that supportive environment, communities, as you mentioned, and then even talk openly about their experiences. And for LGBTQ plus young people or young people of color can feel more of that fear and stigma because of their identities already being politicized. Sorry. And that surveillance creates fear, isolation, and something about We Testify that I want to note specifically is that I appreciate is that when we center our abortion storytellers, we center their autonomy and safety. And in a culture where people feel watched and controlled around abortion and gender affirming care, we create space to tell abortion stories on their own terms. And our storytellers choose parts of their stories they want to tell, what details they want to keep private, and whether to use an alias. And one thing to know is we use practices like Delete Me that finds and removes personal information from data brokers and people search sites. And those for organizing, lending a hand, as you were mentioning, Zoe, those organizing the grassroots and friends having those communities doing these projects is it's really safe to use apps like Signal to communicate, just using things like that. So I hope that answered the question well, but and just to get started. But thank you, Amanda.
Something that I see a lot with parental consent requirements is that the minors can't go to the adults that they trust. They can't go to an aunt or an uncle, or even a parent that's not on their birth certificate. And so when you're forced to work with a certain adult, so your parent, you can't go to the adults that you trust and create and build a community with the adults that you trust because you're forced to go to your parent who, for a lot of minors, not the majority, but for a lot of minors, are people that they cannot trust, and don't want to go to them with that decision. And we've seen minors with like their partner's parents would be supportive of them, or a family member, or even a teacher, but that they can't help them access. And then we see that with the minor trafficking laws, that they can't go to an adult they trust to get out of state to obtain their abortion because that adult might be charged with trafficking. So that kind of surveillance and these parental consent laws are barriers to creating a community with adults that they trust and would be able to support them in their autonomy.
I'll add on to that with sort of the campus perspective, but having really secure, safe spaces on campus that is home or the center for people who are LGBTQ and people who want to learn more about what abortion looks like in our communities, I think is always a really great idea. Throughout my time in undergrad, I would be handing out zines on abortion access in Nebraska and would have students continually come up to me asking, I need to get abortion pills. How do I do that? So being able to have a space on campus where we can talk privately um, and not have adults or that sort of surveillance around where we could both be getting in trouble for that is really great to have. And then, yeah, re emphasizing Signal as well as a safer option for communication. You obviously don't want to be talking about how to access an abortion through a school email. So I will leave it at that.
Yeah, definitely. I also co-find Signal as a great place to share information with each other that might feel a bit safer than anything that's attached to your institutions, or, if your parents can get into your email address, which I know a lot of parents can. Um, so yeah, thank you for sharing that. I wanted to actually follow up on something that you had said, Morgan, about abortion trafficking. And the way that I have seen and experienced this language is the use of very sensationalized language that's actually referring to a real problem, like a real problem that people, humans, young people are being trafficked, often by some of the most powerful people in the country and in the world. And they associate that with abortion and with gender affirming care. We've seen this in multiple states who have these trafficking laws. And even around gender affirming care, I had read a story about a parent who took their child, it was either out of the country or to Puerto Rico to receive gender affirming care. And the other parent had them like sued to have them fly back. So that person could not access care. So there's so much that like even the people who like are there to support like can't really give because their hands are tied. And so that leads me to a question around what's missing from these support structures and support systems that are available to young people.
I could get us started a little bit about that again. And I think this is coming from my perspective of working with abortion storytellers and just being a storyteller myself. I would say I think accessible and consistent support. I'll say like from my personal experience, as I mentioned, like not knowing where to turn and like looking online for media, but a huge part of that was like the gap with me in social media, not knowing who to trust, what like funds that are out there, reproductive justice orgs. And then I would also say like post-support abortion care, like that's just very important. Always checking in on young people, long-term support emotionally, financially, or mentally afterward. And young people aren't getting enough honest, comprehensive information about reproductive health, gender identity, consent, or their rights, which holds that misinformation and fear. Yeah, I think a big thing that's missing is like support through the legal system. If they have to get a judicial bypass, the clerks aren't like told what to do when a minor comes in. A lot of like clinics don't know how to uh, address that with young people who call in to get an abortion. There's a lack of a presence helping navigate
minors through the process. In Ohio, our legal access program is the first program to exist in Ohio that helps minors through this process. And I know many states that's lacking. And in many states there is an org like ours that helps them, but that help is like it's hard to access. Like we try to make our social media very like Gen Z and Gen Alpha friendly so they can get a hold of us. And our website's very accessible, but um yeah, just that support through a very confusing legal process is lacking and creates a massive barrier for just to being able to get to the court and go through that process.
I think the first part of this question was so interesting, talking about quote unquote abortion trafficking and how so many people, particularly people who are anti abortion, conflate trafficking and abortion care. At the clinic, we see protesters often call the police because they suspect someone's being trafficked if they appear younger, usually when they are not white. Um, and in my day job, working on behalf of survivors through policy work, I think we need to seriously look at primary prevention, just to have comprehensive sex education in our schools. Unfortunately, I think with so many of the older anti abortion crowd, it's very difficult to educate and change their minds on this. So being able to have the resources and clearly identify what trafficking is and what sexual violence is. It's not getting an abortion. Being able to have that at a young age and just knowing that, I think, is very important, um, because trafficking and sexual violence are issues that are serious and they are important, but um, they're definitely used to draw at people's heartstrings and um, sensationalize it.
Yes, thank you so much. I wanted to um, come back to something that Nastasia said, and you referenced media. And so I want to ask you all, how does the media, and I'm talking about even social media, reinforce this culture of stigma, shame, and surveillance for young people? And in my mind right now, it's something I've been thinking about for a long time of like um, the trad wife movement phenomenon aesthetic that's happening all over social media, right? Also, the pushing of natural cycle tracking apps and natural birth control apps. So I'm seeing a movement that's sort of like trying to steer young people in a particular way, and I'm wondering what else you all are seeing, that's being represented in our culture, perhaps through media or on social media.
I mean, I see a constant portrayal of teens as not being able to be good parents or not being able to make decisions on their own that are mature and well informed. Um, and yeah, I've also seen the push against birth control, especially for young people, and um, just this like stigma around. Um, Sorry, there's a car alarm in the background, but just stigma against teens being able to make decisions on their own and be mature and be able to understand what their body needs. I see a lot of depictions of them in media as immature or as reckless or not being able to make decisions over their own bodies when it comes to abortion care and gender affirming care.
If other folks are don't want to answer that question, I do have another. Um, we have somebody in our chat naming such a good point, Amanda. How do we reach the young folks in a way that doesn't sound preachy? How best do young people hear debunking of disinformation in y'all's experience? Does somebody want to take that one? Thank you for your question.
Sorry, could we have the question copied and pasted in the chat? Sorry, just to repeat that.
Yeah, of course.
Thank
Um, and I can also repeat it for you. Um, Oh, great. I think a couple of folks put it in the chat. You should be able to see it. So just once again, how do we reach the young folks in a way that doesn't sound preachy? And how best do young people hear debunking of disinformation in y'all's experience? Like how do people best like take in that information? If folks put back into think.
I think as a young person, there are so many adults in my life, older people who it does sound preachy and it's very hard to view them as an ally sometimes. And I think for me at least, um, just having me and other people lead the conversation, um, being able to provide solutions ourselves instead of um, waiting and hearing what an older person might say to us. Um, I think, at least in Nebraska, we've seen a lot more youth advisory boards pop up in different repro spaces, which I think have been a benefit just to have young people making those decisions and not having it be influenced or guided by money or by other people in the room who have more power. Um, so I think cohorts like that are super useful um, to be able to have us be the ones dictating what solutions we have going forward.
Yes, thank you, Zoe. I completely agree. Like having people, young people at the face, at the front lines, and let us provide and also just kind of like personally too, like saying, not saying what we should understand and saying more of like, here are the options and here are some of the things that like you might see, but sorry. Yes, like saying here are some of the things that you might see, but it's actually like this. Like just being there, supporting, and never saying like those things like this is what it is. This is what you should be understanding. Having different language of more supportive language, I would say, as in yeah. And yes.
Y'all have spoken so much to having young people really leading the work, and maybe young people are the best people to reach each other. And I just think that's so beautiful. And I remember being a young organizer. I started organizing as a teenager, and there's so much energy with young people. Like, and young people really do understand their lived conditions in a way that I think adults do not give them credit for a lot of the time. So I wanted to give an opportunity for you all to name any other youth organizing efforts that you found like really inspiring or encouraging, or maybe like what other innovative tools and tactics people are using. You've named support groups. You've named, training people to be doulas. You've named like all kinds of campus organizing that happens. But yeah, what other things are you all seeing that maybe you're not involved in, but you're like, yes, young people are doing the thing.
Sorry, I have a few things, kind of go like in a bullet list, kind of like I would say social media overall, such a really big thing right now. As some, I think Morgan, you said like our Gen Z, like trying to reach that, I would say it's just really important. Like even like Instagram Reels, I've been seeing a lot of creators, like especially like abortion storyteller, like younger, like um younger people and being like, I had abortions. And I'm like, yes, that's exactly what we need to see. And then kind of just like debunking that misinformation through an Instagram reel. I feel like things like that are just very important. And also like digital campaigns. I would say like advocates for youth. Zoe, like you mentioned this a little bit about like the projects that you've been on, advocates for youth, abortion on campus, being able to share those resources, the cards of you can get a medication abortion pills. This is where you can go online. Here are some of the hotlines, just like really like friend to friend, peer-to-peer networks. And also I like Chicago Abortion Fund's peer circles, peer support circles. I did those in college, just whenever when you want to like be in circle and be in community with people. And I will say to uplift, we testify, abortion storytelling 101, which I lead whenever if that would reach a young person if they feel comfortable joining a abortion storytelling 101, just seeing what that's like and just destigmatizing abortion through storytelling. So yeah, those are kind of my things. Also, sorry, youth-led workshops, as we said, like youth leading the work and just seeing if like we have young people on this panel today. That's like a really big thing and that's very important. So things like that.
I don't know the org specifically, but I've been seeing a lot of zines going around, which are awesome. They're super accessible and they're like quick ways to get out information to teens. And um, I think that like that's been something that I've been really appreciating is all the zines that, especially when you go to conferences and they're passing them out and like, um, I think Advocates for Youth does zines too. So yeah, it's just really great work.
Something that I have seen from, I think it was Hydra Fund, they have been doing, I think they did them last year. They're called the People Salon, and just having a space where people can talk and learn more. And I just love how it kind of dates back to historical people salons and being able to just chat about an issue and learn more. I think there's so much information in our world, it can be very difficult to know just know where to go. So having people in a room who are experts in the work, especially young people who have the lived experience, I just think is so important.
Yes, yes. Oh, did you have something else to?
I was just gonna plus one that Zoe, the lived experience for sure. Share, yes. Just wanted to say that. Thank you for bringing that up. So important.
Yes, and I appreciate.
Oh,
I
Amanda,
muted
you were
myself.
muted.
Thank you. I was just going to say I appreciated Zoe you bringing up the people salons. In addition to the zines, it just very much reminds me of like how a lot of like clandestine left organizing has happened for such a long time. When people need resources and they're talking about their lived conditions and how to shift them, we need special spaces for that. And it's really beautiful that like young people are creating those spaces with and for each other and like zines are having such a moment right now. Like it's like great mutual aid in the form of like knowledge share. And I think sometimes that gets overlooked as mutual aid, but it's like teach someone to fish, right? Like you teach somebody something or then they can teach somebody something, you know. And so let me look. Okay, I have just one final question for you all. And it's kind of a big meta question. And you can tackle it however you want, but I'm wondering from you all, especially as folks who have done youth organizing and have had abortions as young people, what would full bodily autonomy look like for young people?
It is such a meta question, and I love it. I think my answer for this will probably shift the rest of my life. And I think part of it is not having not having judgment for people who have abortions. I think that was something that has been difficult for me to overcome having my abortion last year. Just having spaces where it's not looked down upon. I think that it's I've had that be a common reaction, and I wish it wasn't like that. And additionally, I think being able to have, you know, blank on demand. I want everything on demand. I want everything free. I want I want to have complete full access, basically the opposite of where we are right now.
Second that, vending machines, all the things, free, accessible. And for me, it's the way I say it, also, Zoe, thank you for sharing that and for sharing about your abortion. And for me, just a future where abortion access is free from criminalization, shame, and fear, and where everyone can get the care they need. They decide for themselves, care is accessible, privacy is respected, information is honest, no more misinformation, and just supporting and not surveilling. So,
Yes to all of that. And then to add, like, getting rid of parental consent requirements. Making sure youth can make decisions on their own about their own bodies without having to involve adults, especially adults that might be unsafe for them. And so that, and then also, um, yeah, free, accessible, especially free emphasis on that, because a lot of times teens don't have jobs that can afford expensive abortions. Um, and yeah, but basically my big thing is no parental consent requirements.
Yes, y'all, that's tea. I really appreciate you sort of painting that picture for us, because I think sometimes when we think about young people, like there is this sort of protectionary thing that we do that I think oftentimes overcorrect and does the helicopter thing rather than protecting people, or in worst case scenario, like makes parents are unsafe, like makes their environment like truly physically and emotionally unsafe. And so I really appreciate you all sharing like what would it look like if young people had more control over their bodies, had more trust from the people around them, and had more supportive adults, peers, everything. Siblings, like having supportive siblings and friends, like that can make the hugest difference. Like that can be everything. So appreciate you all for that and appreciate you all for truly everything that you've shared today. I want to pull up our slides again if we can, because I want to share some information with you all. About these organizations. And actually, we can put them in the chat too if the slides are not super available. We Testify, Advocates for Youth, and Abortion Fund of Ohio have shared some links with us where you can check out more of their work and you can follow them on all the things. Please follow them so you can learn so much more about the work they're doing and so that you can contribute to the work that they're doing. I think one of the things that we as adults can do for young people is to throw money at their causes. We have most of us have resources. Most of us have jobs, right? And young people don't. Or they've got, their babysitting gig or my first job as a teenager was I worked at Cold Stone. So it's like, yeah, just thinking about that. Like that's something we can do. We're going to share these programs with you all, share these orgs. Please follow them. Please visit their websites and please donate to the work that they're doing and share this stuff with the young people in your lives. This is really important. And that names you or shows to the young people in your life that you are one of those safe people, that you are one of those supportive people. And as we heard from our panelists, that's what we need more. We need more folks who are there to actually genuinely support young people in accessing particularly politicized and criminalized healthcare. I think we've got our links in the chat. And I just wanted to offer another gratitude to you all as panelists. I want to offer gratitude to my tech support team. Thank you all for doing everything that you have done to make this call run. And I want to thank all the participants and anyone who is watching this video in the future. We hope you learned a lot and we hope that you feel inspired to engage with this work and to do everything that we can to support young people who really, really are oftentimes just pushed up against the wall when they really should be supported. So much appreciation. Thank you all for joining us and hope you have a great evening.